Hi, friends. I am Jen Johnson, and this is Thought by Thought Healing, where I talk about everything related to the brain and how your mind can actually be what is causing crazy symptoms in your body, chronic symptoms in your body that feel very, very structural because they're very real. So today I have the opportunity to interview Dr. Alicia Batson, who is double boarded in internal medicine and psychiatry, which is really important and kind of an interesting part of her story that she studied the body and she studied the brain, but missed the mind body connection somehow in there for the first 10 years of her chronic symptoms. And she's going to talk about her recovery and what it took and how learning about how our brains can learn pain, she was able to recover. A little bit about her, just so you know, her background is that she received a bachelor's degree in European Studies from Vanderbilt University, a medical degree from the University of Tennessee Health Sciences Center, completed a combined internal medicine and psychiatry residency at the University of Iowa Hospital and Clinics. She's board certified by the American Board of Psychiatry and Neurology. She's also a member of the American Psychiatric Association, and more and more. Her bio goes on and on. She is one that we definitely can learn from due to everything she studied and her own lived experience in relationship to that. So, thank you for watching. One other thing, actually, we do share a faith, which is wonderful. We actually were able to nerd out together a little bit over for 1 Corinthians 10:13, which has been encouraging to her lately, which is, I'm going to read it to you. Let's see. He will not let you be tempted beyond your ability, but with the temptation, he will also provide the way of escape that you may be able to endure it. We talked about the importance of that in the face of catastrophizing, because a lot of us who have mind-body syndromes tend to fall into some fear at times. Okay. I hope that you enjoy this interview. She is taking new clients or patients. If you are wanting to just meet with somebody to get the green light around whether your symptoms are brain generated and it is safe to pursue this as a mind-body symptom, or whether it is structural, she's a great place to go. And I'm going to put all her information in the show notes. All right, you guys, thanks for watching, and I'll see you in a couple weeks. Bye. Okay, so I am so excited to have Dr. Alicia Batson here with me. Thank you for being here with me.
Thank you, Jennifer. I appreciate your having me. I always appreciate any opportunity to talk about chronic primary pain and how the mind and our thoughts and emotions can actually create real physical symptoms in the body. So this is a great opportunity. So thank you for having me.
Yeah, it sounds like we share that passion very much. I do find that most of the time that I interview doctors, the reason that they are on here is because they also have a story of their own. Is that true of you also?
Yes, that would absolutely be true in my case. Yeah, I have a long story, a 10-year story of chronic pain. So
Yeah.
yeah.
Yeah. Well, let's rewind a little bit here and start back there. What was your story? Maybe start before you would identify as having chronic pain.
Yeah, and that's a very good point. It certainly did. So I think my story begins at birth, frankly.
Okay. Yeah.
I grew up in a troubled family,
Mhm.
and even though I had a great childhood, in many ways it wasn't great, which I didn't identify until later.
Yep.
Um, and I guess I believe in hindsight that I started to develop some symptoms of anxiety and maybe depression around college.
Okay.
Um, and But it felt like it was transient, didn't focus on it, didn't seek help. Um, and like most people with anxiety, felt like it was just a normal reaction to life, just a survival tool, so to speak, and that everyone feels like this. So it
Mm.
really wasn't until after I graduated from medical school and even finished my medical residency that my pain symptoms started. But even towards the end of my medical residency, I began to notice that I was having symptoms, but I didn't know what to attribute them to. So I began to have difficulty opening water bottles because my arms were so weak.
What? Oh, from
Yeah.
weakness.
Yes, weakness. And I thought, well, I just don't exercise a lot. I've been in medical school for 4 years and medical residency for 5. So I just need to get out and do some weights and get exercising more.
Mm.
And then I also started to have anxiety in residency, which I did not identify, but other people have since told me that they saw it in me. And then, yeah, those were the main things. And then it wasn't until after I finished medical residency, moved back home with my husband, we began our first jobs in our fields, respective fields.
Mm.
And at that point, I developed my first chronic pain symptom while I was at work. This was my first job out of residency. I was very stressed out. There were a lot of red flags in that job that had I had better boundaries
Mm.
um, and more authenticity, more self-esteem, I may not have ever taken that job to begin with, but did not have that at that time. So found myself in a position of a difficult job with a lot of departmental stressors, doing things I didn't want to be doing. And in that job is when I was at work one day and I was writing something down, and all of a sudden the pencil, I was actually using a pencil at that point in time. Who
Huh.
uses pencils anymore? But I was using a pencil and it flew out of my hand. I dropped it and developed a sharp pain in my elbow. And that was sort of that was the first symptom. But a lot was going on at that time. And the biggest thing that was going on was that this was in 2003.
Okay.
And my department at the university where I was teaching and working was the beta test department for the first electronic medical record. And so
Okay.
suddenly having to type everything, which was new.
Mm-hmm.
So I was having to
Okay.
type letters to my patients, and everything had to be done, over the computer. And the computers back then were not that fantastic like they are now. It was a new electronic medical record that they were developing, so it wasn't even a polished product. So it was just a lot of newness all at once, which I found myself um, on the computer until midnight at night and back up at 4 a.m. the next morning trying to get all my notes done. And so in that setting, I was very frustrated,
Uh-huh.
um, did not like what I was doing at my work, and had also come back home to my family of origin, and there was a lot going on there. So it was all very overwhelming. And in that setting, I developed my first symptom.
Okay.
Mhm.
There are so many gold nuggets in there.
Yeah,
Um,
it was.
I let's see, where should we start? Let's start with the fact that, as I've read in your bio, you're double boarded. You're a doctor,
Mhm.
and now your body is quote unquote failing you, or something is going on. Um, that's pretty significant considering that's what you studied, and here you are. Where do you feel like at this point in time you're equipped because of all your studying to understand what's going on in your body?
Right. So one would think that I should have been equipped, right? With I was double boarded in internal medicine and psychiatry. So I did a 5-year residency combining both. So if anyone should have understood what was going on with a mind-body symptom or a neuroplastic symptom, it should have been me. But like everyone else I trained with, we didn't learn about this. The closest we got to it was in neurology, where people would have conversion symptoms or
Yeah.
conversion disorder. But that was very specific. These were things like pseudo seizures, or you would lose complete function of an arm, or you suddenly wouldn't be able to walk or talk. So they were very dramatic and
Yeah.
always to do with the neurologic system. And that was really all we had at that time in this realm of mind-body symptoms.
Yeah.
We certainly did not learn that thoughts and emotions in the mind can actually change the physiology in the body, can actually create real physical symptoms in the body.
Hmm.
And so I did not have that knowledge. And when I got my first pain symptom, my doctor did not have that knowledge. So, I did what everyone else does. You go through the standard orthopedic neurological evaluations,
Yeah.
cervical CAT scans, nerve conduction studies. Of course, everything was normal. And they were left shrugging their shoulders, saying, take some time off work. And it only got worse. So it began to affect. I couldn't type, I couldn't write. It jumped to my other elbow in the exact same pattern. And so it was classic.
I love
So
it when it does that.
yeah, yeah.
Yeah.
But it became severe and it grew and it began to travel around my body. And eventually I just had to quit work because at that time, if you couldn't type, you couldn't work as a doctor.
Yeah.
We had Dragon Speak, which was a speech recognition program, but that didn't work very well, and they actually would not allow me to use that because it wasn't as reliable for some reason. So um, yeah, so I had to eventually quit work and begin the journey of trying to figure out what was going on with my body.
So your mind body symptoms, your brain generated symptoms were so bad that you had to quit working in the field you had just spent years and years and years studying.
Right.
Yeah.
Yeah, what a blow, right?
Right.
I mean, it
Yeah.
was like, how did this happen? How did I get to this place? Because prior to that, I felt like I was highly functioning. I always did well.
Yeah.
I succeeded at whatever I undertook.
Mhm.
Life wasn't that hard for me. Um,
Mhm.
and I enjoyed, I felt like I really enjoyed medical school and I enjoyed residency. Um,
Wow.
so it was a real turn. It was very unexpected for me and for my husband. It was not what either one of us had signed up for, we
Yeah.
thought. So, yeah, so
Mhm.
it was a surprise, and it was a long journey. I spent 10 years trying to figure out what was wrong with my body.
Wow.
Um, Part of that was in the conventional medical world, but I didn't stay long in that world because I already knew what they had to offer as a physician.
Yeah.
And I started to notice that they began to like look at me funny and seemed to dread my coming. And I began to feel like, oh my goodness, I'm one of those patients. I'm one of those patients that doctors don't like to see. And I was so afraid of being diagnosed with some sort of personality disorder
Oh.
um,
Oh.
or um,
Uh-huh.
fibromyalgia or something that was really strange. And so I just, when they didn't have anything to offer me that helped, I mean, I did go through physical therapy. I went through occupational therapy. I
Hmm.
rested. Uh, yeah, those were the main things they had to offer. Tried a couple of medications, which didn't help, but I was not a surgical candidate, thank goodness, in hindsight,
Yeah.
and got various diagnoses. My main diagnosis was repetitive strain injury.
Okay. That
Yeah.
was going to be my next question. What were they attributing it to? It
So
was
they attributed it to computer usage.
computer usage.
Yeah. Can you
Okay.
imagine? Now in hindsight, I'm like, oh my goodness, I'm on the computer all day. But this was a new thing in 2003, spending all that time on computer. And it was even really towards the end of my medical residency, maybe the last 2 years of my medical residency. So like 2000, 2001, that we even really began using computers.
Okay. Okay, so you keep saying, which I love, you keep saying new thing. And there's something about new thing that the
Mhm.
brain can not like or see as a threat. What do you think was part of that? Because if we're saying it wasn't overuse or it wasn't repetitive stress or
Yeah.
strain injury, what do you think looking back now? What was it?
Yeah. Well, before I answer that question, I'll tell a little story.
Okay.
I remember my last year of medical residency, I was getting really tired. And I think that was just general fatigue from working so much. And I was getting really tired, kind of emotionally, psychologically, physically. And I remember sitting one day in my psychiatry clinic waiting for my next patient. And I remember thinking about how tired I was. And I was like, oh my gosh, I don't know if I can just keep doing this. And I thought, what's it going to be like when I finally finish residency and start working? Is it going to be better or is it going to be worse? And I was like, I need rest. I need a long period of rest.
Okay.
And next thought, I thought, I wonder what I could get that would take me out, but not permanently. And so I imagined in my brain that I would like break an arm.
Huh.
And because again, there was computers and it was writing a lot, even if it wasn't computers, you were constantly writing as a medical resident because you were writing people's history, you were writing how they were doing that day. I mean, your whole day you were writing and writing and writing. And I remember thinking, oh, I don't want to break my arm. Then I wouldn't be able to do other things that I want to do. And plus, then maybe I'd have to use the other arm. And then I imagined breaking both arms. I had that thought.
Okay.
And I was like, well, I don't really want to break both my arms, but I do wish something would happen that would just take me out. So I had that thought I was probably sometime in the spring of 2003 when I was still in my medical residency, about to finish. And by the time we finished, I moved back home, and it was October, and I had been working for 1 month at my new job. All of a sudden, I got this elbow pain.
Yeah.
By November, it had jumped to my other elbow. So by the end of November, both arms were out.
Okay, so it didn't switch over just to the other side. It spread over, if you will.
Yeah,
Yeah.
it mirrored itself. Um,
Okay.
so so then to your question, what was it about typing? Was that your question?
Yeah, what was it? Yeah, or if it wasn't typing, what was
No.
it?
Yeah, and that's a good question. There were dynamics about typing. So one of the dynamics about typing is that it was instead of making my life easier, this electronic medical record was making it harder. So I
Okay.
had to spend all this time typing my notes after I saw the patient. So
Okay.
at that time, you weren't typing in front of the patient. You didn't wheel in this mobile table with this nice little laptop. You
Uh-huh.
saw the patient, you left the patient room, and then at some point by the end of the day, and they didn't allow you any time to do this, you had to do your note.
Huh.
So I was up till, and then you also had to, as labs would come back, so I was working part-time in internal medicine in a primary care clinic and half-time in a psychiatry inpatient service.
Okay.
And um, as labs came back for all your patients, in the old days, you would have a nurse call the patient and let them know what their labs were. But at that point in time, because they were developing this electronic medical record, they were requiring us to type letters to our patients.
Hmm.
So, dear Mrs. Johnson, I
Mm.
lab work today, your LDL, which is the bad cholesterol, was 150, which is a little bit high, and we like to see it less than 100. Like I was literally typing these letters to patients at
Yep.
the end of the day. And I felt like at that time that here I had trained 9 years to be a physician, and all of a sudden I felt like a secretary.
Okay.
So that was very
Mm.
difficult for me, and I was very angry about that.
Okay.
There were other aspects of the job though, and the job I was doing. types of visits I said I didn't want to do, but they forced me to do them anyway. So I was doing what are called well woman visits. These are women that are just getting their standard annual pelvic exam and other types of, care for women. But I had trained in critical care. So I had trained in combined internal medicine and psychiatry. So the patients I saw were very sick. They had an active inpatient internal medicine condition and an active inpatient mental health condition, both of which were unstable and required hospitalization. So I was used to treating very sick people, and that's what I wanted to do.
Yeah.
And I had been put in a position where I was treating well women. And that was not a field I was interested in. It was not what I wanted to do. So I was a little bit angry about that too. So I
Mhm.
wasn't doing what I wanted to do.
Mm.
Didn't care for my job. My boss had made a lot of sexual jokes during the interview, and or I should say, sexist jokes during the interview. You know,
Okay.
red flagged for now.
Uh-huh.
At time, just absolutely poor boundaries. So I was constantly having to interact with this person who I didn't care for.
Hmm.
On the first day of work, he had handed me a plant. He handed me a plant like the one I see behind you, smaller one. Yeah,
Okay.
that one, yeah, the smaller one. And he said, "Here, I brought you a plant. I'd like to see how well you take care of it." And I was like, "Whoa, I don't know what type of issue this is, but
Okay.
this is very controlling. It felt very
Oh,
manipulative and controlling. And
condescending.
yeah, very condescending, like he was going to judge me as a physician by how well I took care of a plant. And I questioned whether he would have
Yeah.
done that to a male physician.
Sure.
So I took that plant and I took it home and I threw it out.
Well, you took care of it.
Yeah. So anyway, and then I had my family at home. So I don't know. I think the computers were, as you said, something new to blame it on.
Yeah.
And they also represented some level of anger for me, but
Yeah.
I think it was just something, if
Yeah.
computers hadn't been there, something else would have manifested.
Yep. So we talk a lot about repressing and suppressing emotions in this work. Looking back, were you aware of, I mean, I'm hearing urgency and pressure and condescending and frustration and all these things. Would you say that you were kind of on top of processing those emotions, or what was that like for
No,
you?
I was in survival mode. I felt like I need this job.
Okay.
This is my first job. I have to prove myself. And here was another dynamic. My father had been the dean of the medical school at this location for 15 years.
Oh,
Yeah. So
okay.
very big. Yeah. Uh, he had been there for 15 years. This was,
Hmm.
had a lot of emotional layers to it. Uh,
Hmm.
so, so that was there as well. Just expectations of my father, and so.
Yeah. Um, Something I love about your story, which I don't know your whole story, so I might be speaking out of turn here, but a lot of the things you just mentioned are things that it's really easy to overlook. My boss gave me a plant. Who
Mhm,
cares? My dad works for the company I do.
mhm,
So what? I'm doing something new. I'm learning something new. Everybody learns things. They're like easy things for us to just overlook and like downplay. And
right.
we talk about trauma as
Mhm,
a cause of this a lot, but sometimes it's not big T trauma. It's some of the things that you're talking about that are they're big deals, but they don't feel like they should be.
right, right. Yeah, I think it's true. I think it was a whole host of things that all came together at one time. My
Yeah.
father, he was dean of the medical school. He was a physician.
Okay.
So at the same medical center where I was working. So, I wanted to do well. I wanted to succeed. There were a lot of
Mm.
pressure there.
And so you come from a physician's family, so you're going to be very, I imagine, medically minded, especially going through school and having a family
Mhm.
focused on that. And here you are. Trying to figure out what is the cause of your pain. What was that like when you did discover, okay, this is my brain?
Well, that would have been 9, 10 years down the road.
Okay.
Um, and it was wonderful. I was so happy.
Yeah.
It was it was just incredible.
Mm.
It was a miracle. I was so open to that possibility.
Mm.
Um, so there was no resistance. I had just never thought, I never thought that could be true. And it was only suggested to me once in the 10 years that it could be stress.
Okay.
And even when it was suggested to me that one time by a body worker, um, at that time, I felt like, well, that's not possible. Like, I can see that stress might worsen my symptoms, but it could never cause my symptoms. And I didn't care what was worsening my symptoms on any given day or making them better on any given day. I wanted to know what the cause was and how to get rid of it. And
Yeah.
um, so for me, this idea that stress could cause the symptoms just wasn't possible. And so it was irrelevant. Um,
Right.
but when I finally
Yeah.
made the connection with the help of Howard Schubiner,
Oh,
a mind body physician, then I was thrilled and elated. And it was so obvious to me. And it was just fantastic.
yeah. Yeah. I felt the same way when I discovered all my symptoms were mind body. I was like, yes, okay, got it. And
Exactly.
there's a very big difference, like you're saying, between recognizing, yeah, stress can amplify this problem that I have, but
Mhm.
to understand it's actually like the core, the cause of it.
Because, right. Yeah, totally different idea.
Hmm. Okay, so before we jump into you and Schubiner and your healing journey, is there anything else in that earlier part of being in pain, um, symptoms that you think some of the listeners might benefit from hearing about?
Well, I think one of the common experiences during a pain journey is all the different doctors and practitioners you go to and all the different testing you have. As I said, I spent little time in the conventional medical world because I knew what they had to offer and it wasn't much. And I got through that process pretty quickly and then I was done. And I had always been open to alternative um, medicine. And in fact, I had considered at one point going to, instead of becoming a conventional medical doctor, becoming an alternative practitioner of some sort, but did not ultimately take that route. But I'd always been open to it. And so I headed down that alternative medicine world. And, that was a whole other really horrible experience too. Not only did it cost probably, I don't know, somewhere between 20, $30,000 out of pocket, but I did every treatment offered under the sun at that point in time.
Mm.
So multiple different types of practitioners. And as a lot of people do, you go to massage therapist, you go to acupuncturist, you go to various body workers, you take various different types of medicines, supplements, minerals. Um, and one time I spent 4 months getting daily deep tissue massage in another state, away from home.
Yeah.
And actually, I did that twice.
Huh.
And the whole time you're thinking, maybe this is helping. I think it's better than nothing. It's helping a little bit. And you're just so desperate to
Yeah.
be better that you accept a little bit of help. And but by the end of it all, you're exactly where you started, and maybe even worse off, because along the way, someone has said something to you that scares you. So maybe it's a body worker that said, hey, it looks like one hip is more rotated forward than the other one, or I think one leg is longer than the other, or um, maybe, you'll never get better and you'll just have to live with this, or a doctor who says, I think it's all in your head. So along the way, and then the treatments themselves can scare you because you hear noises coming from your body, or you think, when that body worker did this, it hurt my body, and then I got another injury. So, this process of trying to get better is fraught with all kinds of sort of landmines.
Yeah.
Um, and none of them are actually harming you, but you think they're harming you, or they could harm you.
Mhm.
And then you're not getting better, and you're spending a lot of time and a lot of money. So I didn't find the alternative medicine world any better than the conventional medical world. And I think a lot of people do have that experience as well.
Yeah. Yeah. I do feel like a lot of people actually confuse alternative medicine with mind body medicine. And that can be a hard one to help people to kind of separate that out. So thank you for hitting that. I think that's important. You also touched on, I'm going to call it the white coat syndrome, if you will. Like a doctor says something that
Mhm.
scares you, and um, it sends off the danger signal. Um, you already hit on it, but I just want to hit on it again for the watchers. What suggestion or, I don't know, advice would you have for those that are carrying, conscious or subconscious narratives of things that people that we respect, that have these degrees, have kind of spoken over us at about our bodies? How to, what do you have to say to that?
Well, I think for the patients, it's important for the patients to understand that conventional medical doctors and honestly, most alternative medicine practitioners are not really trained in this,
Yeah.
and in mind body approaches, psychotherapeutic approaches to chronic primary pain.
Yeah.
Um, and so, the truth is, it's not their fault
Mhm.
that they don't know what's going
Yeah.
on. They not only do not know the science, they're not taught that this is possible, but they're also not taught the language with which to communicate with the patients about what is going on. And so you can be in situations where they're saying things that aren't helpful and that are actually harmful, like it's all in your head,
Mm.
or you may not be able to get better, or you may have to just learn to cope with this. Or your body is not symmetric.
Yeah.
Nobody's is. And then even if they had the knowledge and they had the language, most of them wouldn't know where to refer for actual treatment. And, it's really just this mind body approach to chronic primary pain that actually has evidence now, good randomized controlled trials, evidence based medicine, that it actually is effective. Um, Cognitive behavioral therapy does not have evidence that it's effective. Uh, Acceptance and commitment therapy does not have good evidence that it's effective. So those studies that showed benefit, meaning benefit more than placebo on both of those,
Yeah.
actually showed, CBT showed that it brings down your pain scores on a scale of 0 to 10, 0 being no pain, 10 being the worst you could ever imagine. So just your average analog scale. CBT, your average CBT brings down your pain scores about 0.6.
Yeah. Okay. Point 0.6. Mm-hmm.
Yeah. So as a prior sufferer,
Yep.
you and I know that that means nothing.
Yeah. Right.
0.6 on any given day means absolutely nothing, right?
But as you talked about with massage earlier, if we see
Right. If we
evidence at
think
all that something can take it down a little bit, we
right.
are more than welcome or more than happy to go down that route. Yeah.
And then acceptance and commitment therapy actually moves the bar 0.
Okay. Okay. Interesting.
Yeah.
Uh-huh. So what are you suggesting in opposition to that?
So if you look at the Boulder back pain study, which was the study done by Asher and Alan Gordon, Dr. Schubiner was involved in it. 66% of the patients
Yeah.
were had almost no pain or no pain after just I think it was 8 sessions of therapy.
Yeah. Yeah.
And that was after having an average of 10 years of chronic back pain. average of 10 years of chronic back pain. After just 8 sessions, 66% either had no pain or almost no pain.
Yeah, that's it's amazing. So pain reprocessing therapy was what was used in
It's a
that, right?
combination. It was pain reprocessing therapy, but there was also emotional expression and awareness therapy combined with that. Yeah.
Yeah,
So
yeah,
it was not only dealing with reframing the pain, changing your relationship to the pain, which was the cognitive behavioral piece, but it
yeah,
was also dealing with any repressed emotions related to past trauma.
yeah, yep. Okay, so if we look at chronologically where we are in your story right now, we've gone to school, you're double boarded, you have all these symptoms, you're recognizing they're not medically explained. Um, well, not in the traditional sense, anyways. Um, can we hit really quick on you talked about weakness and maybe just name a couple of the symptoms that you had because weakness is one that can be really scary for people. So maybe talk about that a little bit.
Sure, that was my first symptoms. It was just general weakness in my forearms, so I couldn't open any type of screw top,
Yeah.
bottle, jars. It was very subtle, and I've never been a strong person, so it didn't really surprise me. I understand it, um, then paresthesias developed, which is the numbness and tingling in your hands.
Okay.
But it then began to go to my back, so tightness in my upper back. It went to my hip, to my knee, which were old injuries that flared back up. My foot, old injury, flared back up.
Hmm.
Uh, and then, um, and then, what really brought me to my knees was about 7 to 8 years in when I had my first panic attack.
Oh,
And that I didn't even know what was going on. So here I was, a psychiatrist. I had
yeah.
spent my career diagnosing panic attacks. I could see them a mile, I could see them coming a mile away. Like I knew what a panic attack was. I knew exactly how to diagnose it. I never missed the diagnosis, but I couldn't see it in myself
Yeah.
because it was so layered with all these physical symptoms at the same time. So I was at my physical therapist office. She did something that scared me
Hmm.
and immediately had a panic attack. My whole back went into a huge spasm. Anyway, that set off a series of panic attacks that were very severe. It took me a while to recognize what they were. And then that, I don't know what was worse. That was really bad. But what was equally bad was when I developed hyperacusis, which is sound sensitivity.
Okay.
Um, and that was very difficult, just normal everyday sounds, a door shutting, dropping a spoon on the floor, someone chewing ice. Um, all sounds were extremely painful to my
Mhm.
ear. And I also couldn't chew on one side. So I couldn't even chew kale. Like kale was too much for me to chew. It
Okay.
painful. So I had to be really careful, like how I prepared food. And then during this whole time, I developed what I thought were all these, or I had, or I don't know, all these food sensitivities. You know,
Okay.
I had done the whole food sensitivity testing, which, in medical school, we're told not to do, that it's not specific, it's not sensitive, it's not a good test, it tells you nothing. But in desperation,
Wow.
done that. And lo and behold, I'm suddenly sensitive or allergic to 13 different foods, which I had never been sensitive or allergic to before. And so that made my diet impossible. And my poor husband, we both lost weight. But yeah, so there was just a whole breadth of symptoms. I don't know, 20 to 30 different symptoms over 10 years developed.
Okay. I love that about the food sensitivities. To hear that that's even talked about in medical school is
Mhm.
pretty cool. Yeah, they're not very reliable.
Yeah.
Okay, so in the last 10 minutes here, you've met Schubiner. Tell me about that switch for you and what changed in your life
Mhm.
to move towards recovery.
Right. So it was pretty quick. I was literally lying on my couch at home. I was racked with anxiety. I was racked with pain. I had my hyperacusis, so I couldn't even hardly leave my
Mm.
home. And certainly couldn't socialize. I couldn't eat anything because I was sensitive to everything. And I was crying. And so I called up a former physical therapist
Okay.
and was just in a desperate state and was like, can you think of anything that could possibly help me? Because I never gave up. I was always like,
Nice.
I've got to figure this out. I'm going to figure this out. I'm going to, you sink or swim. And I was not ready to sink.
Hmm.
And so I'm still swimming but desperate, crying out for help, literally. And this physical therapist said, Elisa, I don't know what's wrong with you, but I had another patient who had a miraculous recovery by going to this website. The website is Unlearn Your Pain.
Yeah.
She said, I've never been to the website. I don't know what's on the website, but maybe it will help you. So,
Wow.
yeah, wow, that she had never been to it herself
Yeah.
after a miraculous recovery. But anyway, that's a different story.
Mm-hmm.
Um, so, um, so I laid there and I was like, oh, and it was hard because I had difficulty interacting with the computer, but my path to recovery was by finding resources on the computer. So it was always this push pull, this like, I've got to do this, but it hurts. I've got to do this, but it hurts.
Yeah.
So I was like, oh, I don't want to get on the computer one more time. But I did. I got up off the couch, I went to the computer, and I started reading this website.
Nice.
And within 5 minutes, I absolutely knew without any doubt that I had found what was wrong with me and my path to full recovery.
Yeah.
And I was so incredibly grateful.
Yeah.
So, the website described it, it knew me, it knew my history, it knew my history of trauma, it knew my family, it knew my personality,
Yeah.
it knew the nature of my pain and what I was going through, my medical experience. Like it knew everything about me
Yeah.
and it had a path to full recovery. So I picked up the phone. I was just like, this is amazing. I don't know what's going on. I'm calling right now. And I expect, of course, administrative assistant of some sort or a
Uh-huh.
nurse to answer the phone on the other end because I knew this was a doctor in a hospital. This was Dr. Howard Schubiner.
Yeah.
And I called and he answered the phone.
He is so funny.
And I was like,
Oh.
oh, Dr. Schubner, I'm so sorry. I didn't expect you to answer the phone. I'm tripping over myself. And he said, okay, what do you need? What can I help you with? And so I told him who I was and I told him my story. And it took about, no, 5 minutes, 7 minutes, 10 minutes. And he said, oh, I absolutely think that you have mind body symptoms and I think you can fully recover.
Yeah.
It was amazing.
Yeah. Okay. So here you are, you have hope. And then I don't want to put a timeline on your healing, but it would be nice if maybe you shared um, with the listeners, I don't know, 3 nuggets of what you would want them to know that's important for the healing journey.
Mhm. Um, so it took me about, Dr. Schubner ultimately referred me to a one-on-one therapist like you, someone like you, and I really needed that. So some people can get, I think one of the lessons there is that some people can get better by reading a book, and we refer to the sarno method of recovery all the time, and people do that, or they can come to you one time and then be hopping out the door and never need to come back. So there's some people who can have these really fast, quick recoveries, but that's not most people.
Yeah.
There are another group of people who can read a book or a few books and recover, or do an online program and recover. And that's fine. But again, that's not everybody. There are some people, and especially people who have a history of trauma, I think, who would benefit from a one-on-one therapist. And I was one of those people. And so I got one-on-one therapy for about, I'd say it was a little over a year, maybe 14 months.
Okay.
Um,
Yeah.
and I didn't want to leave therapy. I was ready to keep going. But my therapist was like, Elisa, I think you're good. I think you're good to go. I think you can handle this. And so I kind of got nudged out the door and I was like, oh, I was being rejected. But I was scared to fly, it was just, so impactful, the therapy, and so helpful. And by that time, I think I was about 90% better in my symptoms.
Yeah.
So I went forward, and I decided I was going to test myself, test my body. And so I did one thing I had always wanted to do, but had not done was a triathlon. And I had not ever done one because I was afraid to
Yeah.
do.
Uh-huh.
So I knew by now this was all about fear, right? This is all about getting over your fears. So I thought, well, I've got to do that thing. I have got to show myself that I can do what I want to do and I don't need to be stopped by fear. And so I trained for a triathlon and I did it and it turned out great. And I thought,
Okay.
well, if I don't, I didn't get any pain during it. I didn't get any pain after it. I wasn't even sore the next day, which is what really surprised me.
Hmm. Okay.
Um, yeah, so that opened up some other ideas about, post-exercise soreness. And so then I decided I was going to test myself one more way. My husband's a big cyclist and I like to cycle too. And so we went to Europe and did the Paris-Roubaix challenge, which is when tourists can come over ahead of the big official professional Paris-Roubaix race, cycling race. It's an annual spring classic race in Europe every year. But the day before, tourists can come and ride the path or sections of the path. And so I did a section of the path, and my husband was doing a longer section of the path. He did like I don't know, 6 hour ride, and I did like a 3 hour ride. But I wasn't with him was the point. And so I was there on myself and by myself. And the thing about that ride that's so different and makes it a classic is that it's over 200-year cobblestones.
Oh,
The cobblestones that Napoleon actually would have crossed. So these cobblestones are gnarly.
yeah.
They are not like smooth mortared stones on the road. I was ready for them. I came up from the paved road and was coming up onto the cobbled road, and there was an ambulance already putting a guy in the,
Oh
in the
my
ambulance.
gosh.
Poor guy, he had hit the cobblestones and just fell out. I hope he was okay. I don't know what happened, but that was like, oh my gosh, here it comes. And so I hit the cobblestones and my neck started vibrating so hard. I have never felt that vibration in my whole body and especially my neck ever in my life. And it was constant. And I thought, you know what? If I don't get chronic pain with this, I am never going to get chronic pain again. And I did the race. I didn't get any chronic pain. Fortunately, I never fell off my bike, which was good. And had a great time. And by the end, I was like, this is it. I think I'm ready to go back to work now. I've tested my body and learned a lot.
Yeah.
So I eventually worked my way back into work slowly. I didn't jump back in with both
Okay.
feet,
Okay.
water. And Yeah. So, and then, so I think, I don't know what the lesson was in that, but that, be patient with your recovery. I always tell people don't test your recovery any more frequently than like every 2 months. So a lot of people will read a book and say, well, I'm not better yet. Or they'll do a program and I'm not better yet. I thought I was going to be better by now. And so you have to be patient with your own recovery.
Yep.
And so, generally every 2 months, I say, if you're just a little tiny bit better every 2 months, then it's working for you. You're good to go. You just need to be on the road to recovery. You don't need to be at any point on the road to recovery.
Nice.
So, yeah.
Yeah.
So that's one of the pearls, I think.
Okay.
There's so many techniques these days. So, you really have to do what works for you, and what works for one person may not work for another person.
Yeah.
So, Howard Schubiner says, I didn't start getting better until I started meditating.
Hmm.
Well, I don't like meditating. And to me, it's the most miserable thing anyone could possibly do. So,
Okay.
but I know a lot of people love it. But so, whatever techniques you're using
Yeah.
to recover, I think, these recovery programs can be tailored, between outcome independence, somatic tracking, emotional and awareness expression writing exercises,
Yeah.
um, various types of journaling, that are specific to chronic pain. So,
Did
but
I'm curious if you did journaling.
I did not. I did write a couple of times. So, Howard Schubiner has the book Unlearn Your Pain.
Yeah.
And that was the first thing I got to try to recover. I was like, I'll order his book.
Yeah.
And I opened up the book and I started to read the first paragraph and I had a panic attack.
Oh, love it.
Oh,
Okay.
okay, ouch. Yeah, don't want to do that. Shut the book. So the next day I thought, well, I was just a little scared. I'll come back to it. Opened up the book, started to read the first paragraph, panic attack. So I was like, Dr. Schubner, I've got a problem here. Your book is giving me panic attacks. And that's when he said, I think maybe you need to be with a therapist.
Okay.
Yes. So again, but other people can read Unlearn Your Pain and have an amazing experience. But later on, I went back to Unlearn Your Pain, and he has several types of writing exercises in Unlearn Your Pain, like writing letters to a loved one
Mhm.
that you're going to tear up and throw away. And I think that may have been a point in my journey, but I personally found it tedious and I didn't have the patience for it. And so I didn't do it.
Okay.
People find it amazing.
Yeah.
And again, that's my point that,
Yeah.
different techniques I think work for different people. And that's part of what we do as therapists, right? Is just figuring out where is the patient, what is going to help them the most and
Yeah.
guide to that. Yeah.
Yeah. That's awesome. Writing was really worked for me. It still does. It's how
That's
I maintain my emotional state and
yeah.
yeah,
No,
so
I recommend it to people all the time. I know it works.
yeah.
It just wasn't, I didn't have the patience for it at the time. I
Yeah.
think I'm a talker. I like to talk. I like to talk with people, and I just wanted to keep talking.
Yeah, which is why I'm going to guess part of why you wanted to continue working with your therapist. Yeah,
Yeah.
it's a safe space for that. Okay. So I'm hearing like created exposure to reliving your life or facing your fears, however you want to verbalize that. And then uh, not like outcome independence, not tracking your improvement every day and measuring how much better you are.
Right. No, right.
Playing around with tools to find what works for you and what
Mhm.
doesn't, and,
Right.
and catering it to your journey. Go ahead.
Yeah. Well, a big thing for me was changing these personality traits.
Yeah.
That was huge for me. And that's where I did most of my work. I mean, I did a lot of outcome independence. I did a lot of, they didn't have somatic tracking at that point in time. It
Okay.
wasn't. So I used graded exposure. I used
Mm.
outcome independence. I talked to my symptoms a lot.
Yep.
I switched up activities. So I would run for a couple of days. And if I started to get knee pain, then I'd swim for a couple of days and I'd start to get elbow pain. Then I'd bike for a couple of days. So I was always switching up my activities to
Nice.
kind of use my brain
Uh-huh.
so it wouldn't latch into one symptom.
Okay.
But the personality traits for me, I think were very big. And these were the perfectionism, being a high achiever,
Mhm.
big being a people pleaser, that was huge, and
Mhm.
just having these chronic fear thoughts. And this had all to do with my family of origin. Um, and so learning how to dial those back enough that I didn't make myself sick with them, learning to practice self-compassion, learning to draw appropriate and healthy boundaries, um,
Yeah.
learning not to scare myself. My favorite mantra during that time was, it's going to be okay either way.
Yeah.
What that meant to me was I would get caught a lot in trying to control outcomes. And so I would be having to choose one thing or another to control an outcome.
Mhm.
And I had to learn that it was going to be okay either way, that I didn't need to control the outcome by choosing the right path or the wrong path, that I could just deal with any problem at that time that it arose, that I had the tools and techniques to address anything that came up. I didn't need to plan it in advance or avoid it, or it wasn't my responsibility. I didn't need to feel the weight of the world's shoulder, weight of the world on
Yeah.
my shoulders. So,
Yeah. Those personality traits, all of the ones you just mentioned, I resonate with them so much, and learning how to change them. And some of them for me, at their core were a blessing, but we're just carrying this burden that was just too much on top of
right,
something that was actually kind of good, um,
right,
been distorted. So I
right. Right.
resonate with what you're saying. Yeah. Okay. I've kept you longer than I said I was going to. In closing, what are you doing these days? Are you taking on clients? What does that look like for you in your current world?
Yeah, so I currently work over talkiatry.com, which is an online mental health platform for mostly psychiatric care, though we do have therapists as well. I work for them, so I see patients on their platform. I am certified or licensed to see patients in the states of Tennessee and Missouri right now.
Okay.
Um, so you have to be in those states for me to see you.
Yeah.
Um, and I mostly do an evaluation. So I spend time with patient, helping them about, taking their history and helping them decide what part of their symptoms might be a mind body symptom versus an underlying structural cause,
Mm,
and giving them my opinion on that. But then I usually refer patients on to treatment with a mind body therapist,
nice.
um,
Okay.
since I do traditional psychiatry uh,
Okay. Great.
normally,
Okay.
medication management. Um, so I'm doing that. I also spent the last few years developing a online training program for medical professionals, for therapists, for anyone who works with people who have chronic pain, including body workers or yoga instructors for that matter. Anyone can take it. It's called OvidDX,
Uh-huh.
OvidDX.com. It's an app that you download, and it teaches people how to diagnose and treat chronic pain, chronic primary pain, and mind body symptoms.
Yeah.
So I've been doing that, and yeah, that's about it. Yeah.
Okay.
So,
I will put all those in the show notes. So if anybody wants to either get the apps or work with you for a session,
oh,
um, they can reach out. So yeah, thank you. I appreciate your time. Is there anything left on your mind that you just feel like you have to get off your heart?
not in particular, but I do always usually close with just telling people not to give up.
Yeah.
You never know when your pain is just around the corner, because it's not necessarily a linear recovery.
Yeah.
It has a lot to do with these light bulb moments, and you don't know when you're going to have your light bulb moment. Yeah, so don't give up, keep trying, and don't feel discouraged. This is a new area of medicine, and we do have good scientific
Mm.
evidence-based studies now that this treatment works.
Mm.
And so you can feel hopeful, and that's one of the most important things in
Yeah.
any recovery, is there's that feeling of hope.
Yeah. Love it. Okay. Thank you. Thank you so much for your time. Thank you for your passion. People like you, we want everybody to hear and know about it because there is hope. So thank you.
Absolutely. Yeah, thank you, Jennifer. All right.
All right,
Bye-bye.
listeners. Bye. We'll see you next week.